come to order. Good morning and welcome everybody to today's full committee hearing examining the implications of the Affordable Care Act on the Department of Veterans Affairs health care. As we all know, about 3 years ago, the Patient Protection and Affordable Care Act, or Obamacare as it is commonly known, was signed into law. Today's hearing will focus on just one aspect of the law that I believe has received distressingly little attention from the administration and the media to date: its potential implications for the VA healthcare system and the many veterans that it serves. Despite informing this committee last summer that the department was developing a proactive communication strategy to inform veteran stakeholders about the potential impacts of the ACA, VA's website devotes just 2 sentences to the law, stating that it, quote, will not affect the current role VA has in the lives of America's veterans, end quote. But, as we all know, stating that the so-called Affordable Care Act will not affect the department is not the same as saying that it won't affect veterans. Secretary Shinseki testified before this committee earlier this month that the Affordable Care Act has important implications for VA. VA's fiscal year 2014 budget submission includes a request of $88.4 million to implement the provisions of the ACA and meet the department's responsibilities as a provider of minimum essential coverage. Buried in Volume 2 of VA's subject budget submission, lacking context, justification, or supporting data, is a single statement alleging that VA assumes that it will experience a net enrollment increase as a result of the law. What that net increase may be and why VA believes it will occur and what actions the department has taken to prepare for it are unknown at this time. Unfortunately, these are far from the only things we don't know. Less than a year from full implementation, we also don't know how veterans may respond to the new care options available to them and how enrollment and utilization of VA health care benefits may be affected. In turn, how increasing demands for health care services will affect competition for health care providers, and in turn, VA's health care workforce and recruitment and retention efforts, particularly for hard-to-fill positions like psychiatrists. Whether VA's current information technology systems are capable of fulfilling the law's data requirements, which include identifying individuals who are enrolled in the VA health care system and reporting their coverage status to the Department of Treasury, or if or whether the critical role of the VA health care system will change in the post-ACA national health care landscape. Sadly, I could continue. A report on uninsured veterans issued last month by the Robert Wood Johnson Foundation and the Urban Institute states that it remains to be seen the extent to which uninsured veterans would seek coverage through Medicaid, the VA, or other options under ACA, and whether and how this will vary across state lines. Former VA Undersecretary for Health, Kenneth Kaiser, published an article last year in which he stated the overall net effect of the ACA on the health care for veterans is uncertain at this time, although it will likely have a number of intended positive and unintended negative effects. Where the health care of millions of veterans is concerned, unknowns of this magnitude, this late in the game, is unconscionable. According to VA, we have to implement it before, and now according to VA, we have to implement it before we can find out what effect it may have on our veterans. This House has voted more than 30 times to repeal and replace various elements of the ACA, and I've been proud to support that effort every time. And it's no secret that I and many of my colleagues have been critical of the law from the start and remain even more critical of and concerned by it today. Increasingly, we are not alone. Just last week, Senator Max Baucus One of the chief authors and primary advocates of the ACA called the implementation of the law a train wreck. The American public cannot afford a train wreck, and what's more, our veterans do not deserve one. Thank you all for being here today, and I mean that with great sincerity. I yield to our ranking member, Mr. Michaud, for any opening statement that he may have.